strategic planning, project management and business development with a core concentration of revenue growth and ROI. Starting the career from a 100-bedded hospital to being the principal driver and managing a 1,850-bedded tertiary care setup, constantly driving efficiencies to show year-on-year improvement in bottom line, driving common values across the organization and leading the growth initiatives, both organic and inorganic, with special emphasis to an asset-light model through operation and management contracts. Exposure to 360-degree aspects of enterprise journey by virtue of being involved in predominantly greenfield projects across India, including tertiary care hospitals and medical institutions, and his journey through various stages of his businesses. As an outgoing personality, well connected to the healthcare and business fraternities at various levels and across geographies, he's based out of Chennai, India, with an entrepreneurial wife and sons. Thank you so much, Mr. Venkat Phanider, for joining us this afternoon.
Thank you so much, and thank you for the nice introduction that you have given. So the photograph, so it looks very young, so I have to replace it next time. Is it very important to have that light, or we can? I know I'm dark with it. So Dr. Manivandan is not here, but he was very unfair because he knows that I can speak for hours, but he gave me only 30 minutes. We are not in the ICU, you can be stress-free. I want some smiles here. Can you? Are you all attentive? Raise your hands. Thank you, Dr. Sridhar. Your insights were very well taken, and you are very humble the way you put it exactly. And no wonder why Manivandan wanted to hear in Kaveri in India. So most of the time, planning critical care infrastructure, most of you, I'm sure, okay, you will be having a lot of information about how to create an ICU. We are all from healthcare fraternity. Must be doctors, administrators, owners here, are aspiring administrators. The purpose of me here is to ensure you that to induce that adequate knowledge which will support you to get you a good ICU for your hospitals. There's a beautiful saying from Winston Churchill, though I don't personally like him, but still, we shape our buildings and thereafter they shape us and our future. And it is absolutely right. So when we talk about creating an infrastructure for a hospital, particularly with reference to critical care, so what are the things that drive critical care? It is increased incidence of chronic diseases. When you have increased pediatric population, yesterday I was talking to somebody, they were telling that they need 200-bedded hospital for exclusively pediatrics in Chennai. They are looking for a place. If they don't get, they want to construct one. Increased road traffic accidents, that's not a good sign, but still, okay, you have a lot of ambulances plying on the roads, okay, carrying these accident victims. Emergence of new diseases, COVID is a testimony, you all know, and there are so many others in the pipeline. Demand and supply gap. If you see per se, can anybody tell me how many medical colleges, private and government together, within a radius of 60 kilometers from Chennai? How many of you are from Chennai? None of you? They're close to around 20 if I'm right. They contribute to almost around nothing less than 25 to 30,000 beds. And most of them are vacant. If you see the population to bed ratio with reference to Chennai's market, we don't need more beds. But definitely we need more critical care beds. There's no debate about that. We all felt that necessity when COVID hit us hard. And of course, the revenues. Traditionally in healthcare, we always thought the surgery brings more money into the hospital. Unless you have a plan of action where you do more number of surgeries, you don't actually make break-evens and make revenues at the top level at the bottom. But we realized later that critical care is one such area. It will also build your brand, at the same time your revenues as well. So that is one more driver that you have to consider, and you have to have an ICU. And recently, critical care has been recognized as a separate super specialty. There are MD courses that have been implemented by the National Medical Council as well. So you have to first know your numbers. Before, this is where most of the time you will fail. Either you will overdo or you do which is inadequate. So when we plan about having a hospital and plan for how many number of theatres and how many number of ICU beds that you actually need, you will have some friends from within the industry who will be guiding you, and everybody will have a contradictory information and advice you. So the ideal number of ICU beds, depending on your actual bed strength of the hospital, are defined. And it says at level 1, which is a 50 to 100 bedded hospital, you can have up to 8 to 10 beds. And if it is a level 2 hospital, which is between 100 and 150 beds, you can have anything between 12 to 16. And if it is tertiary care, in tertiary care and quaternary care, it's level 3A and B, they are defined. And in level 3, you can have around 20% to 25%, 50 to 25%. In level 3, where you have quaternary care, including ECMO and LVADs, etc., then you can go up to 25% depending on the size of the hospital. So when we plan a critical care infrastructure, there are 4 zones that you should not forget. I feel in my 2.5 decades, I have over 2.5 decades of experience in healthcare, that when I look back and see my journey, okay, ICUs are the most abused infrastructures in the healthcare. Of course, the greenfield projects that are happening now with the help of some good architects and good critical care experts like Dr. Sridhar, etc., they bring in some good infrastructure and they meticulously work on how functionally they are feasible, safe for every stakeholder. But otherwise, most of the time they are very abused. There are space constraints, they are not a safe place for the patients. Okay, the attendants are completely abused without any stress relief measures. So, if you are going for an ideal ICU that will meet all the requirements and make you a brilliant hospital, then you have to choose these 4 zones when you are constructing an ICU. The zone 1 is the patient area, obviously where the patient bed is there, and the surrounding areas where you have the bedded panels and your patient side couch and etc. So that would be ideally between 150 to 250 square feet. What I see, I have seen ICU beds and patient areas as less as 70 square feet. A doctor cannot even walk next to the patient bed. One side only can, the other side he can't. He can't even go to the head side of the patient when the critical ill patient, if he lands up any heart attack or something, then you have to go behind the patient and do some workup, then you can't even reach out to the patient's head. And then there is zone 2, which is observation zone. Okay, that means I mean here observation is your nursing area, your doctor's area, where the doctors and the nurses stay. Okay, there's a lot of documentation and monitoring happening there. And you will also have some critical equipment, okay, like ABG machine and etc. So that particular area should be anything between 20 to 25% of the total area. And then comes zone 3, which is ICU support area. If you have an 8-bed ICU, I am sure 2 beds will be supporting, having the equipment will be pushed into those 2 beds. You will see on the bed of the, how many of you would honestly tell me, okay, on the bed of the ICU there will be monitors kept. There will be doctors and nurses and technicians, bags and food carriers will be kept. How many of you would have seen it? At least Sridhar himself, yes. That is because you don't take care of actual requirement of those who are contributing to the ICU's growth and sustainability. So the zone 3 is something to do with ICU support areas like your store area for medical equipment, your sterilized doors, your dirty utilities, and your toilets, your fluids, etc., your pantry there. So these things have to be taken care of in zone 3. And zone 4 obviously is family support area. I really pity the most abused attendants in the healthcare is the attendants of the ICUs. They come with a lot of hope, leaving every hospital to us thinking that we'll get the best treatment in that hospital. And they pay from their nose to us. Even today in India, you know that almost 10% of the population still get into debt because of paying their medical bills. Despite all these things, because they come with a lot of agony, they come with a lot of stress from home front, also at home. They have a lot of ambiguity about the future of the patient. And we don't care about that. We just ask them to sit in a chair, and sometimes there is no water facility, no toilets, no fan, and I have seen in some places they sit outside under the sun and the rain. So please take care of that, because when Dr. Sridhar was also referring, it is very delicate when you speak to the attendants of the patient. When you speak to them, you have to be very careful, and if you are going to break a bad news with the patient, okay, the kind of treatment that you have given to the attendant matters a lot. He will recollect everything, how you suffered for 10 days or 5 days in the hospital, sitting outside without food, without water, without fan, mosquitoes biting. If everything goes on well, he will be a happy man going, but he will definitely give a bad feedback about how he was treated, not the patient. But if something bad happens, then there will be a substantial, agitation because of his experience as an attendant in the hospital. So zone 4, though you don't have space, you have to create space for that. Put yourself in the shoes of them and then think, you'll definitely agree with me. And the patient areas to the entire area should be 1:1. Say for example, you have a 10-bed ICU, that is, even if you take the minimum 1,500 square feet, at least another 1,500 square feet should be for the rest of the facilities. And 10% of the ICU, because after COVID we all realize, okay, there are a lot of infectious diseases coming and they cannot be put in the same ICU, so at least 10 beds, okay? 10% of the beds of the total ICU must be converted into negative pressure ICUs where we can put isolated patients, isolation patients, and decide number of beds in an ICU. This again, you have a lot of space, you put 16 beds, you put 20 beds in the same ICU. You don't have space, you put only 4. So, when you create a particular infrastructure, every bed is a revenue maker, right? The real perspective of the business, the bed is a revenue maker. You remove one bed or make something else out of that, then your revenue will take, because there is no provision for you to make money out of it. So how do you manage? If you have 4 beds or 6 beds, your ICU may not be a very viable thing, because your manpower, the variable cost, that's what we say in finance, okay, the variable cost will not meet, and it may not be, your EBITDA may not be as desired. So the ideal ICU must be anything between, ICU should have 8 to 12 beds. If you go beyond 12 beds, then obviously your service standard in the ICU might come down. There might be exceptions, that's a different thing, but it's a general perception. There's a lot of research done on this. They say that an 8-bed ICU to a maximum of 12-bed ICU is a very feasible model, and that will be a very sustainable model in terms of patient care. Deliverables, clinical outcomes will be better, patient care will be better, and your revenue models and optimum utilization of infrastructure and manpower. So location of when you plan this with the location. Just because you have something in the basement, no, you can't do it. We don't prefer the ICUs either in the ground floor, because why do you think ground floor is not? Because ground floor, there's access points for the entire hospital. So there will be a lot of people crisscrossing, there are a lot of chances for intruders. Security will be compromised, noise will be more, crisscrossing will be there, infection can be occur. So ideally we just push them into the higher floors, first floor or whatever it is, doesn't matter, because today you have high speed elevators which can take you to any floor in no time. And it should have easy access to emergency and OPD. So if you are a new hospital, you are going to construct a new hospital, you are going to construct right from the beginning. Ideally have a separate lift. It makes sense. Lift doesn't come with a lot of effort or money. Okay, you get lifts at a very cheaper price today. So the lift can be exclusively for exclusive access it will have to the critical care, and it will go straight, vertically straight from the ORs and the ground floor emergency and the diagnostic areas. It will have access separately for ICUs, then it will go through the ORs and various other ICUs in different floors if you have. Okay, so that's also a good idea, but if you don't have that option or your existing hospital, so prefer to have the ICU in such a place where you have access. It can be a staircase, it can be a lift, it can be a ramp, whatever it is, but you cannot, it will not take a longer road to the emergency or ORs. And there is hardly anything called HDUs. Not many hospitals have this concept of HDUs. Normally, 50% of your ICU beds you have to have HDUs. Now, most of the time, there is an indicator in NABH as well, patient returning from wards to the wards or rooms to the ICU within 24 hours or 12 hours. I am not sure what's the timeline, but it happens, and to reduce that incidence, okay, patients can be moved to an HDU, high dependency unit, okay, and then from there they can directly either be discharged or they can go to the rooms and wards. And you can also have certain patients who does not require ICU admission, so you can save ICU bed for some of the critically ill patients, and the HDUs can take care of such patients. So when you plan an ICU, irrespective of the bed, 50% you also plan for HDUs. So easy access to elevators, staircases and ramps, easy access to diagnostic facilities. You can't take a roundabout to go to your labs or approach your blood bank or to your radio diagnosis services. Secure entry and exit. This is very important. You can have 1 or 2 layers of security to reach the ICU, because you know that the very common factor in India is violence against the doctors and the medical fraternity, and it happens. It is irrespective of the job, but it happens across India and the entire world. So in such circumstances, you should protect our property, our infrastructure, our patients and our personnel. So you can have 2 layers, and you can have access controls, you have some security measures. Ideally, it is better, other than the emergency exit, you should have only 1 entry and 1 exit from the ICUs. That will also protect you from, pilferage of some key medicines and equipment and consumables, disposables, etc. And please avoid ground floor as ICUs. Just because you have a space available in the ground floor, you better have your office there, not the ICU. So what kind of environmental infrastructure that you have, which will sync to them, will create an environment that is good for the patients and all the stakeholders who are contributing to the welfare of the ICU. The first thing is noise levels. So 45 decibels in the morning, 40 decibels in the evening, and 20 decibels of noise levels in the night. So what is the normal conversation decibels? Anybody knows? Normal conversation? If you know, please tell no. Otherwise, because I don't have 40 minutes, I have only 30 minutes. You don't know, I will tell. No? So it's 55 decibels. But the normal conversation between a wife and husband doesn't fall into that category. Okay, so that will be much higher. So normal conversation is 55 decibel. And what is the night time 20 decibels? A wall clock ticking is 20 decibels. A wall clock ticking is around 20 decibels. So that is the kind of noise levels you are supposed to maintain in the ICU. And about lighting. So people have this wrong perception saying that it's bright, the patient gets well soon. It's not like that. There are certain standards set. Light makes everything difficult for you and everything easy for you as well. So have you seen this film making? Any shootings you would have seen, right? If you are having a shooting, there will be a lot of light coming from the sun. The shootings happen early morning, there will be during the sunrise, it will happen in the midday, it will happen in the night also. But then you will control the lighting so that there will be a standard picturization made. So similarly, you have to control your lighting. Okay, normally, you can take it as it will be calculated as foot candles. Okay, and 1 foot candle is around 10.7 lux. Okay, you all must be aware of lux, so it is 10.7 lux for each foot candle. And that should be the standard, and your engineers, your electrical engineers will be guiding you on that. But take it as a thumb rule that your lighting cannot be anything just because you are fascinated by a beautiful light, very bright, don't go for it. Consider it as a very important factor for the physicians when they are doing their procedures. It is important when the patient, he doesn't want to be exposed to a lot of light, it will matter. Okay. And natural lighting is one of the best things because it will also prevent a lot of infections and it will control infections. So try to give as much as natural lighting possible. And then patient overhead lighting can be around 20 foot candles, that is right up over the patient. And then HVAC. Most important is air conditioning. So air conditioning, we perceive, unless we feel freezed, we don't think that it is really air conditioning is working. No, it's not that. Depending on the location, depending on the size, depending on the height of the building, depending on the floor, where it is accommodated, depending on the ceiling, you have to consider. You have a lot of consultants, you can consult them. Normally, in our standard, like Chennai and all, we consider anything between 30 to 24, 25 variation amount of. You may ask, 18 is too cold. No, 18 means air conditioner should be capable of delivering 18 Celsius, what do you call it, centigrade air conditioning, because you have a lot of equipment. Okay, you have ECMO or any other equipment. You have a lot of ventilators running in that particular ICU, a lot of monitors running in that ICU. You have a lot of people working there. Then all those things also have to be calculated. It's not just the area which is supposed to be calculated. So be very, very specific when you are looking at it. So it should be anything between 16 to 25, but ideally 18 is also good, 18 to 25. So it should have a very robust air conditioning system. And in some places where you have cold places like North India, etc., probably you will also have a similar kind of heating system also, which will maintain the temperatures as 25. Am I audible? So the other recommendations here are the, you can also have fluorescent lights, okay, which will give you a better feel of the skin tone, etc., and it will be more of natural in lighting. And then you must have a blindfold for your patients, because sometimes you need the light there, or you're doing some procedure, you may not be comfortable. So either you have some curtain or you have something to put on his eyes so that he'll be feeling comfortable. So we miss on these smaller things sometimes, which will give a very bad experience to the patient. So environmental requirement, again, false ceiling. Okay, the ideal height would be, today we can't get 10 feet height of the false ceiling. Even if you get around 8.5, that's a good size. And what kind of false ceiling you need? You need a grid false ceiling, or you need tiles, or you need a plain false ceiling. And you can also have some design, some murals on the false ceiling, depending on the height and the size of the the ICU. Okay, it's smaller ICU. Okay, and you can't have so much of colors and murals there, then that will look even smaller. So consider anything. Fall ceiling can be anything, but we prefer a fine finished fall ceiling, not the bricks. But the kits are very easy. I mean, grid here is the tile fall ceiling, very easy for maintenance. But then we recommend, because there will be gaps between the grid and the tile, so it may also attract some dust, and dust particles can go and sit. It can lead to some infection. So normally we prefer a gypsum board or something which is cleanly plain gypsum, etc. Cleanly done. So that is one thing, and then it should be sound absorbing. So that is very important. Okay, it should absorb the sound, because otherwise there are instances through that it can go out. People can hear, and it can be disturbing the rest of the people. I don't know how many of, when we stay in our apartments, you will listen sometimes in the night when we are sleeping. You listen to what is happening in your upper floor and your ground floor. Okay, when you are sleeping, so that should not hinder the rest of the patients. And then your furniture and furnitures. Select. You have hundreds of vendors coming and giving their. Don't overdo when you are investing on the furniture. Do be very calculated, because there is no end for spending in ICUs. You can spend lakhs and lakhs of rupees, but kindly consider robust beds or side tables or bedded tables, whatever it is, your bedded panels, your bedded lights, etc. Consider them on the basis of other hospitals and their client list. Okay, if their clients are good in the industry, they are productive industry, they are in terms of their activity industry. If you are convinced, then go with them. And maintenance. They should have a good track of maintenance, etc. Also create a small place for every bed. Create a small place where you can have a information board, so that when the doctors come, they can read something. Any critical information can be pasted there. Have a small place for the patient to keep his family photo or something which will soothe him. Okay, it will give him more, maybe the God which he believes. Okay, or a family photo, his granddaughter or grandson. Okay, wife, whatever it is, so that he will feel comfortable, he feels rejuvenated, he feels stress-free and relieved of that. And information technology, central monitoring system is inevitable today. Okay, most of them are carrying it, and EMR is very important. With EMR, it will be helpful for you to retrieve data of all the investigations and the radiology investigations, etc. The films can be seen through archiving system. So adequate computers, printers, scanners, and your barcodes. Okay, so most of the time we see there will be a printer, the scanner will not be there. If there is a scanner, then there will not be a barcode. Okay, so have it as a set. So all the activities that an EMR requires, we sometimes need barcodes to be generated. Okay, for the pharmacy or for the labs. Okay, so sometimes we need a scanning mission which will to escalate to the issues to the insurance company. So all these things are required. So have a workstation that is having all these facilities. And medical furniture, as I said, electrical parts, bedside furniture are very important. Normally we request to have around 7 electrical points, that's 6 per 5 or 15 amps electrical points of around 7, and out of that at least 50% must be having UPS backup, so immediately. And now good thing is, in medical equipment, most of the medical equipment you are having power backups for anything from 30 minutes to 1 hour to 2 hours. So consider those kind of equipment, because it will also come as a lifeline for you during some disasters. And as I was telling you earlier, clean and dirty utility, and also have a map. So we all know in the last 5 years we have come through around at least 2-3 disasters. Okay, there was Chennai floods, and there was a big Tufan, cyclone was there. So we are all vulnerable to these things time and again. Nothing comes to us with an information or an inspection. It comes as a disaster can occur anytime. So you have to be prepared. You should have a good fire assisting system, okay, that is already been set down by the fire department. Okay, then you must have a backup for your oxygen and air suppliers. You should definitely have this, because if one of your pipelines are not working, and then you are nowhere. So you should have a backup line for oxygen at least and air. And then you have alternatives for power. You should have a decent UPS, okay, which will serve your equipment and some lighting for the patient and the service areas, and at the same time also generators exclusively for ICU if possible, because it will also save a lot of money for you there. You need not have the generators working for the rest of the hospital. With all critical areas you can have a separate generator, so at times that will be of some help to you. So floods are very common. Okay, most of our hospitals are built decades ago, and now the roads are over our almost the level of our floors, the ground floors of our hospital. So in such conditions, you should have some submersible, powerful submersible automatic pumps which will be pushing the water out, and you should have good drainage systems as well. So when it comes to the human violence and attacks, okay, you should have adequate buffer zones to safeguard your equipment and your manpower. And infection breakdowns are very common. Hospital-acquired infection we still fight despite being advanced in our technologies. So the best practices should be taught time and again to all those people who are involved in carrying out their work at the hospital ICUs. And it is ideal to have a wash basin at least for every 5 beds, if not every bed. So doctors, I was telling that you know that I speak for hours, but you gave me only 30 minutes. It's very unfair, but I think I am running. So yeah, I think. So that is about the disaster preparedness facility that are most of the time ignored, as I was telling you earlier. When I go for rounds in the morning, at 11 o'clock I will see the nurse, the technicians, the IMR, the doctor, the junior doctor, the intensivist. Everybody will be sitting in a small room, and they will be having one puff or samosa and one tea. The room will be stinking. Very small room. They don't have a decent toilet, they don't have a decent place to rest. They will be under constant stress. You all know about it. Okay, so create infrastructure. Please take care of your people, they will take care of your infrastructure, and what you want they will deliver. So ensure that, okay, don't worry, okay, you are losing 2 beds or you will get little space. Okay, these things will contribute to it in the longer run. So give them the comfort. Okay, you should have adequate lockers to keep their valuables. We all see, okay, whatever be the experience of the hospital work, whether they are MBAs or whatever it is. But we would have definitely come across complaints coming from the doctors or any other staff nurse. My watch is missing, my money is missing, because you don't have enough space, lockers. You don't have enough, change rooms. You don't have space for them to eat. So kindly consider all these things. How small or big is different, but it should be adequate to the needs of your ICU. And also the patients. Most, as I was telling you, most abused attendance in the entire hospital is the attendance of the critical care. So kindly give them. See, one attendant for a critical care patient, personally, okay, as a seasoned administrator, I don't recommend. You should have at least 2 attendants. And why we need 2 attendants is because it can be an old lady, so somebody should guide them. Okay, there should be an young man, 2 people. At least console each other. So one will go to buy something, okay, and then the doctor will be calling. The gentleman who is there, he doesn't know how to interpret what doctor is telling. So at least 2 people to support each other morally. You need 2 people. So we actually ask them to go. Security, we'll have one security. Most of the security, we change the security agencies, but the security will be the same. Okay, how far you keep on telling him, you should respect the patient attendant, he is your God, he will Okay, like just like how when you are parking in T-Nagar, how that fellow, they love us. So kindly treat them with dignity, okay? And definitely you will not have to face any violence. At least you can mitigate the chances of violence because they feel that they are treated very well. At least they don't know how they are treated inside. The attendant, how is it, but they will correlate with how they are treated outside. Give them a cup of coffee. Our average length of ICU patient is 5 days to 6 days, say for example. Average revenue that you get is anything between 35 to 60,000 rupees. Can't we afford to give them one glass of tea free of cost? At least when you are breaking a bad news to him, he will recollect all this. No, these people treated me very well. So it means they would have treated him the best inside. So do these things. You are a CFO will definitely tell. After 1 year, he will go to Dr. Madhivanan and say, sir, key cost to the patients, attendants, is around 1.5 lakhs. It's ridiculous, sir, no hospital gives. But he will never tell how much they earned, how much goodwill you have earned. Okay, which is going to translate to another hospital in another part of Chennai. He will never explain. So, but I am sure he is a very intelligent man, very knowledgeable. He is very subtle saying that he is not knowledgeable, but he is an amazing person. I am very gifted to have him as my friend for almost now 1.5 decades. So please kindly take care of these two people. I believe always you take care of your people will take care of you, and the relatives part don't ignore. So with that, my friend, at a lighter note, we have one more slide. Takeaways of a planned and good infrastructure. So what are the takeaways? Increases accessibility and towards your essential services. It ensures economic effectiveness, that is functionally it will be effective in terms of saving monies for you, cost saving will be there, and capacity building will also be there. Increased life cycle of infrastructure, you have the right things in the right place and the right build and the right products used. It will obviously what goes away in 5 years can be extended to 10 years. And it may incur a little marginally the prices, the cost could go up, but then when you say at a whole, okay, you will be saving it over the time. Control over clinical and operational concern. As I told you, if you have good control systems of buffers between the general public, etc., your water supply, your electricity, your HVAC, etc., then obviously you will have more functionally more appropriate, and that will also result in good clinical governance and clinical outcomes, and it will provide you safety at all times, if not all times, most of the times, okay, and you will not be landing in any problem, and it will create a lot of respect, okay, and acceptance from all the stakeholders, that is not just the patients, the attendants, our own staff, our own community, and our own well-wishers. And I know I feel as if I am in an ICU. So they're all stressed out, okay. So on a lighter note, okay, I just made this just before entering this place. So you are in the hospital called Medicall. This is very appropriate today. Okay, so I feel you are in the hospital. The diagnosis planning critical care, and your primary consultants in me, and I think I infused information and administered the acquired knowledge over these 2.5 decades. And I'm not sure, that's why the query, okay, adequate knowledge absorbed, I hope, okay, and the review, we'll all see you if he gives an opportunity in Medicall Chennai 23. And for emergency, you can take my email and send me a mail, okay, I'll be always available. And thank you for the opportunity given, Medicall, and thank you so much for a patient hearing. Have a great day.
Thank you very much, sir, for